Hi, I'm Dr. Sridhar K. So we have had many videos on breastfeeding, the feeding pattern, the effects of excess feeding and so on. So one common question we get is it possible to overfeed a breastfeeding baby? The answer is yes. I mean, obviously, all of us have faced situations when we go through a period on a diet and then we feel our appetite has come down. And on the contrary, when we go on binge eating, our appetite keeps increasing. So we are not satisfied anymore with the amount we used to eat. So there is no reason to believe that the babies are any different. So we can teach them to eat less, we can teach them to eat more. And it's very important from a physiologic point of view that the first 5 to 7 days, it's a critical period in terms of epigenetics, the programming effect. And there have been many studies by Dr. Lucas and Atul Singh's group, and obviously it does make a critical difference to your future eating patterns, your future health, the risk of obesity and everything else. So how you manage the feeding. So nature has a reason for why the breast milk is low in the start. Obviously, the colostrum is concentrated in immune factors and it gives essential nutrients that the baby needs in a very small volume. So this allows the volume contraction that happens in the babies, the weight loss that happens after birth, the physiologic jaundice that happens. So jaundice even is protective because bilirubin is an antioxidant. So to some extent, these changes are important for us, and the low volume that the baby gets and gradual increase encourages the baby's satiety pattern to develop to an extent that it won't risk future obesity. And the digestive ability of the baby, because the baby is not being fed within the womb, the placenta is supplying what the nutrients are needed by the baby. So the digestive ability of the baby doesn't abruptly increase to a peak level. And the exposure to sugar like lactose, for example, or the proteins in the milk stimulates the production of these enzymes which are needed to digest the food products, and this increase happens over a period of time. So I have often mentioned about the physiologic lactose intolerance in the first 3 weeks or so, especially after the breast milk starts coming in. So that is the reason for most of the changes we see, the explosive stools, the frequency of stools increasing, the slightly greenish stools, and of course nappy rash risk and so on. But most of the time this is manageable by carefully allowing the baby to regulate what feed volume is needed. When we are breastfeeding, this happens as a natural process. Some mothers, they don't face it in the first baby, but because the milk output is more in the second baby, if they tend to overfeed the baby, you may feel physiologic lactose intolerance is more. I've also come across some mothers commenting on my video on lactose intolerance that the pediatrician has recommended them to stop breastfeeding. This is absolutely the wrong advice. Please don't do that. You just need to regulate your breastfeeding. So what leads to overfeeding in a breastfeeding baby? Obviously, in the first few days, we encourage you to feed frequently. Our aim is to stimulate the production. Our aim is to make sure the baby gets enough, so there is enough urine output. The dehydration phase is improved, because we discussed on the video on hypernatremia that not getting enough milk is a risk for dehydration and high sodium in the blood. We do not reach that situation if we support the feeding adequately. I also mentioned ways to increase the breast milk output. I will refer you to the video on that as well. So you can stimulate by expressing as well, especially if you have a cracked nipple. You can't continue to latch the baby for a long time. You feed the baby for 15-20 minutes on the breast, and then you express to stimulate, and the express milk can be given by a syringe or a cup feeding, so you don't use a teat in the early stages. So these are ways to counter the production issues, but once you start producing, we may have issues due to excess feeding if the baby keeps feeding at the same pace. Once you start getting the milk, once you've seen the weight gain, once the urine output is good, the baby starts sleeping better, that's a stage when you let the baby take over in a way that you don't over assess the hunger cues. You don't try to force the baby. If the baby is sleeping, it's safe to let the baby sleep for 5 hours or so in a full-term baby who is of a normal size. And as the baby starts growing above 1 month, for example, they can sleep 6 hours continuously without any problem. So you allow the baby to sleep more. And one advice I commonly give is not to feed too soon, because many times the baby is picky for various reasons. They may be uncomfortable for need of a nappy change. They may be uncomfortable because they just want to be cuddled. So if it is just 1 to 1.5 hours since you fed and the baby looks a bit uncomfortable, you try other ways to hold the baby, move away and walk around to cuddle the baby. This becomes more important when the colic starts, because the baby is restless due to colic as well. And one of the reasons why colic happens is because of the physiological lactose intolerance. That's only one of the reasons. You can refer my video on colic for the remaining reasons. But if you overfeed the baby, if you give the baby milk constantly, there are two issues which happen. One is the baby gets an extra lactose load. They're already struggling to digest the current lactose load. Giving it in a slow phased manner helps to digest. But if you give too much in one go, they start getting bloated, they start getting irritable, and they feel discomfort. So one thing is not to feed too soon. And also the duration on the breast is important. If you feed for more than 30-40 minutes continuously when the baby is getting a lot of milk, even though only in the first 10 minutes or so they are actively feeding, they do continue to get milk on top. So this leads to both a little bit extra breast milk volume as well as tendency to reflux, because when the stomach is full and you give milk on top of that, there is reflux, and that's why we get many babies crying excessively after 2-3 weeks. They spit up sometimes. It may be silent reflux if they don't spit up, but this phase is very important to recognize as well. So slight head and elevation and reducing the time you put the baby directly to the breast. You can decide that based on when the active sucking stops. So if the baby is sucking actively for 5 to 10 minutes and then slows down, that's a good time to try off. Many parents are not keen on using pacifier, and I wouldn't encourage them to use that. However, if you feel the spacing is not possible otherwise and the baby is not letting go of the breast, using a pacifier between 2 to 4 weeks onwards till 3 to 4 months is a reasonable option, because that is a colicky phase. You may consider it with exclusive breastfeeding successfully happening, as I've seen in many parents. So it's a balance of how you approach it. So overfeeding in a breastfeeding baby can lead to reflux. It can lead to excess weight gain. This also resets the satiety center, so it may predispose them to obesity in the future. So though we say breastfeeding babies regulate well, the regulation depends on how well we interpret the cues. So the hunger cues can be overinterpreted in a colicky baby or a restless baby for other reasons, and also anxious parents, because we decide that baby has to gain weight at a certain pace. We decide that the baby has to pass a certain number of stools or urine in a day. Of course, we need to make sure the baby is gaining weight reasonably, but within the profile of the growth chart for the baby. You don't need excess weight gain. You don't need to set a pattern. If a baby is small, they can continue to grow on the smaller side as long as they are healthy. So please be aware of all these important factors when you decide how much to feed. When it comes to formula feeding, again, we start going for a high dose right from the beginning. The breast milk has a gradual increase, and in a formula fed baby, the same thing we describe for a experienced mother takes place, and they start getting a bigger volume straight away. And one thing I've told before and I repeat now is that the formula company tins, they recommend a higher volume than most babies need. So you can comfortably give 30 ml less or even 60 ml less as they grow older, and the baby will still be satisfied. If you are doing the occasional top up for a breastfeeding baby, the volume required will be significantly lower than what is recommended on the tin, because the breastfed baby takes less volume. So for the future health of the baby, remember that overfeeding can happen with both breastfeeding and formula feeding. You don't need to be too focused if you are watching the cues well and you respond reflexly, as happens in most mothers, but don't be anxious. And if there are signs that your baby is getting too much milk, like the physiological lactose intolerance or the excess colic or the reflux, you need to take a step back and try to reduce that pattern. I hope this is useful. It's a very important topic, and please do share. Thank you.